Marhaba everyone, this is Rand.
Hi everyone, I'm Fatima. Welcome back.
We're excited to have you here for our 7th virtual medical Arabic session. So today we're going to be talking about counseling patients in Arabic for their psychosocial history, which we covered in our previous video. So make sure you watch that one first, because this one will make a little bit more sense. And then we're also going to cover the sexual history and function, which, as you know, is a sensitive topic for most patients. So knowing as much about the culture and as many terminologies as you can help make the patient feel more comfortable and help us take care of their health. And then we're also going to be covering the family history portion of the HPI.
So the first thing we're going to be covering today is counseling patients. As you remember earlier in the last video, we have discussed how to collect information about patients' exercise and diet and alcohol consumption, as well as drugs and sleep. So in this portion of this video, we are going to be talking about how you can counsel them, how you can influence their behaviors and tell them about what we recommend normally. So when we were talking about exercise, if you remember, we asked how much exercise the patient is doing, and if they're not doing as much exercise, or if they're asking you, hey doc, or how much should I be doing every day? You should tell them it is recommended that you exercise for about 30 minutes, 3 to 5 times a week. These are the recommendations from the American Association of Cardiology, I believe. So cardiovascular health. So the way you could say that to an Arabic speaking patient is you would say yunsah. So yunsah means it is advised. Be with. So it's advised with. It sounds a bit off when you say it word for word in English, but when you put it all together, it makes sense. So yunsah bi mumarasit. Mumarasit means to do something. Ar-riyada means sport or exercise. Li for 30 or 30 daqiqa. Daqiqa means minute, and 30, or you could say 30, they will understand you. So you could say 30 daqiqa, 3 to 5. So you could even show them your hands. 3, 5. Ayyam means days. Bil usbu' in. So bil in, usbu' a week. So altogether, I know it's a very long sentence. ينصح بممارسة الرياضة ل 30, or you could say 30 دقيقة 3 إلى 5 أيام, or 3 to 5. You could show them with your hands, or you could say 3 to 5. Most patients will understand what 3 and 5 mean. أيام بالأسبوع.
Okay, next you want to ask them about sleep, how many hours they're sleeping per night. And then if they ask you, oh, how many hours should I be sleeping? Or if you want to tell them how many hours they should be sleeping, you could say ينصح بالنوم 7 إلى 8 ساعات باليوم.
So next, we're going to be talking about how many drinks should they have. A lot of patients, especially in the United States, they will be consuming alcohol, but it's a lot of the times it's over the limit or over how much they should be drinking. They might be asking you how much they should be drinking. So it is often recommended to drink no more than 2 alcoholic drinks per day for men and 1 alcoholic drink per day for women. So how are we going to tell that to an Arabic speaking patient? Again, the same word that we were using earlier. Yunsahu bi means it's advised to. Shorb, if you remember that word from drinking that we talked about in the last session, shorb means to drink. Akal min, akal means less than, min is from, so less than. So yunsah bi shorb akal min. 2, you could say 2, or you show it with your hands, or ithnan mashrub. Koholi means alcoholic, mashrub is a drink. Bilyawm means daily. Rajul, Rajal means like a man. So 2 mashrub kohuli bilyawm Rajal. You don't have to tell them that, it's just for you, so you remember it's for men. And for women is nisa. So 1 or wahed mashrub kohuli bilyawm. Again, drink alcoholic per day. We kind of switch in Arabic, you switch the adjectives with the term, so it's flipped than English. So in English you say alcoholic drink, in Arabic you would say drink alcoholic. So مشروب كحولي باليوم.
Oh, you want to advise them about smoking. If you want to say nicotine is harmful, addictive, and can cause cancer, you say nicotine, which is nicotine, مضر يسبب الإدمان والسرطان. So nicotine مضر means nicotine is harmful. يسبب الإدمان means is addictive, and والسرطان means and cancer. So النيكوتين مضر يسبب الإدمان والسرطان. So then if you want to ask them, do you need help to quit smoking? You would say بدك مساعدة بتبطيل التدخين. So بدك means do you want, مساعدة is help, تبطيل is like quitting, and then تدخين is smoking. So altogether بدك مساعدة بتبطيل التدخين.
So now we're going to move on to the sensitive topic of asking patients about sexual history. This is something that is sensitive to any patient that comes to you in the clinic, not just Arabic speaking patients, but it's more the reason why you want to be a little bit more cautious when talking with those patients, because those patients are often not used to discussing these things. And on top of that, there's also the language barrier. So you want to try to make them feel as comfortable as possible. And just a little bit of background, which ties into the cultural component that we've talked about in the last video. If you remember, if you don't remember, make sure to check that out. So a little bit of the background is that regardless of the religious backgrounds, most patients from an Arabic culture, they wait until marriage to engage in sexual activities. And as such, a lot of them are going to feel a little bit offended, maybe that you're offering them a pap smear or that you're offering them an STI testing. And a lot of them actually will not even know a lot about sexual activities or may not even bring up any concerns at that point because they're not used to it. So make sure you're understanding that, keeping an open mind and kind of meeting the patients wherever they're at. And this is not only for Arabic speaking patients, this is for everyone. It's a great advice to just make sure you're meeting the patient wherever they're at. But just keeping it in mind, being more conscious when you're talking about pap smears, pelvic exams, or even like some of the diagnostic things that are very routine in other in diagnosis for certain illnesses, such as PCOS, for example. One of the criteria is doing a transvaginal ultrasound in order to be able to visualize the ovaries better and make the diagnosis. But if someone is an Arabic-speaking patient and they do follow that part of the culture, then they might be refusing that, and it's not because they are not willing to get treated or they're not willing to getting diagnosed, but it's important for you to investigate and ask a little bit what makes them feel more comfortable. And you could then go on to different modalities of diagnosis, such as a transabdominal ultrasound, for example, or meeting the other criteria for the diagnosis without having to make the patient feel uncomfortable or stop them from getting the care that they need.
So next, we're going to talk about some sexual history transitions. And so our school actually taught us to do these even when we were doing the HPI in English. So we just wanted to cover it as part of our medical Arabic curriculum. So if you want to say, I will ask you about your sexual health, you want to say, راح أسألك عن صحتك الجنسية. So راح أسألك, I'm going to ask you, عن صحتك, about your health. And then in Arabic, it's just flipped. So عن صحتك الجنسية would directly the translation would be about your health sexually, but the patient would understand what you're trying to say. And then if you want to say our conversation is confidential, you want to say حديثنا راح يكون سري. So حديثنا is our conversation. راح يكون means is going to be, and then سري means confidential or a secret. And then let me know if you feel uncomfortable would be خبرني إذا كنت غير مرتاح. So خبرني, let me know, إذا, if, كنت, you were, غير مرتاح, uncomfortable. So altogether it would be خبرني إذا كنت غير مرتاح.
So then after making them feel comfortable and making sure you have your transitions down, you want to ask them, do you have any concerns about your sexual health? So في means is there, عندك is do you have, أي, any, مخاوف means fears or worries or concerns, عن صحتك الجنسية. So you can remember those two words that Ran just used. صحتك الجنسية means your sexual health. So في عندك or عندك if it's a female, أي مخاوف عن صحتك الجنسية. The other one you want to ask if they are sexually active. أنت ناشط جنسيا or أنتي ناشطة جنسيا. Again, the same TA opening for females. تا. So أنتي ناشطة جنسيا or أنت ناشط جنسيا. That's if you're sexually active. And do you use protection? The same thing, if you remember from our earlier video when we said the present tense for using something or doing something is BT, bit. So بتستعمل or تستعملي means do you use for man, تستعمل for woman, استعملي. حماية means protection. Do you use protection? And they will know what you're talking about. So بتستعمل أو بتستعملي حماية.
Okay, next we're going to start our family history portion of the HPI. So, if you want to ask, are there any diseases in the family? You can say في أي أمراض بالعائلة. So are there any أمراض, illnesses or diseases بالعائلة, in the family? Altogether, في أي أمراض بالعائلة. And then if you want to ask about specifically like specific family members, you will say, how is your mom? So شلون صحة أمك? How is your dad? شلون صحة أبوك? How is the health of your children? شلون صحة أولادك? And how is your siblings' health? شلون صحة أخوتك? And so you would already know at this point how to say, you would already know at this point if they have any siblings or like who they live with, et cetera, by watching our previous videos. But just a quick review of that. Ummak is mom, abuk is dad, أولادك is children, and أخوتك is siblings.
And just to continue a little bit about the family history, obviously you don't just want to ask if they have illnesses, you also would like to know the ages, to know how the genetics works, and if there's anything you need to be worried about at the point. So what age did he or she die, depending on which family member you're talking about. So BA at what? Omar. It sounds like Omar if you've heard that name before, but it's Omar. Matt or Matit. So Matit for a female. Obviously, usually, as you've noticed before, females just have extra letters. So the longer version is the one you use for when you're talking about female adjectives. So BA, Omar, Matat. What age did she die? Or BA Omar Mat, which is what age did he die? So obviously, this again is not an exclusive list. So sorry, it's not an exhaustive list. So if you want to know any other illnesses and their names, comment below or ask us on our email and we'll be able to get back to you as soon as we can. But these are some of the most common reasons why people pass away in the family and the most common things that you might hear. So heart attack is jalta qalbiya. If you remember from our video about the body parts, qalb is the heart and jalta means a stroke. So, or heart attack. So jalta qalbiya means heart attack or heart stroke. Old age, kibr, sin. Sin is age, kibr is high or big. So kibr sin means they died of old age. Cancer is saratan. And fun fact, it's the same term used for the actual animal, the cancer, the same thing you see in horoscopes. We also call it saratan as an animal. So yeah.
But next we're going to cover some of our Arabic culture just so that we can make sure we're learning about the culture. We know a little bit about the patient to make them feel as comfortable as possible. So today we're going to be talking about mental health.
Yes, so mental health is not something that has been at the forefront of healthcare in general, not just in Arabic-speaking countries, but also in America as well. And as you may know, in this day and age, and this generation has been a lot more conscious about healthcare and seeking answers and seeking help whenever it's needed. However, this wave has not fully reached patients in Arabic-speaking countries just because patients, just because of the lack of the access to care, as well as the patients in there only go to a doctor when they genuinely really need it. Like I've had family members who break their arms and they just kind of like tie it to their neck and they're like, we're fine, it's going to heal on its own, we don't need to see a doctor. However, there has been a movement also in Arabic speaking countries now to seek help for mental health as well, especially as you may know of the wars and the difficulties that the families are going through nowadays. So it's important that you're conscious of that. You're not expected to be a therapist. You're not expected to be their psychiatrist or know how to have a full-fledged Arabic conversation in those. But it's important to make sure that the patient feels heard, that they feel like they can ask you any questions they may have or tell you any worries they may have. And you could try to appoint them to the resources or to the people who could better help them. So it's not necessarily that mental health is stigmatized if you are approaching the patient and telling them, hey, I noticed that you are telling me signs of you being anxious or you being depressed. It's not necessarily stigmatized, but it's not something that people are always conscious of or they're paying attention to until it manifests as psychosomatic symptoms. So it's always good to talk to the patient about it, create a safe space for them, and try to kind of maneuver the conversation in a way where it makes them feel comfortable and want to share more with you.
And then no matter what field you're in or what type of healthcare provider you are, it's just important to know that there is ongoing research, and specifically about Arabic speaking patients or Arab Americans. There's not a lot of research or data, and there's ongoing research, but there's like currently not a lot of research that has already been published. So it's actually hard for us to know like what our patients need, which is why it's really important to address it when they come to you. And it's just, if you're going out of your way to address something that we don't know a lot about, it can just go miles for that patient's health and just help them with their overall well-being. So just to keep that in mind.
And here we've collected a couple of resources for Arabic speaking patients specifically. I know this might be a little bit cut off on your screen, so I'll try to adjust for that. But we will be including those resources down in the description box below in case you find yourself not needing them now, but at some point in your healthcare career, if you encounter a patient who needs help and you're not really sure where to go, these are some of the resources that we have found and heard about being really helpful as like a starting step to help those patients. Feel free to share any resources you may know that you don't see on this list with us, or if you have any questions or comments about specific things and how to approach them with Arabic speaking patients, feel free to let us know. And thank you so much for tuning in today. We are really happy to be able to share this with you and have an outlet to talk to you about these topics that are really important. And again, feel free to reach out with any questions via our email or leave them in the comment section below. Thank you.